team of nurses doing a community teaching regarding the knowledge deficit to nutrition in women and caregivers with children ages 0 to 18 months. Our goals at the end of teaching include women being able to verbalize proper weight gain and nutrition in their infants and toddlers, and we broke down our teaching into 3-month increments starting with newborns.
Newborn nutrition 0 to 3 months. Desirable growth and development of the newborn is enhanced by good nutrition. Feeding the newborn provides an opportunity for parents to meet the newborn's nutritional needs, as well as an opportunity for them to bond with the newborn. Adequate calorie intake is essential to provide energy for growth, digestion, metabolic needs, and activity. Nutritional needs for the newborn are as follows. According to the American Academy of Pediatrics, all infants who are breastfed or partially breastfed should receive 400 IUs of vitamin D daily beginning in the first few days of life. Infant formula has vitamins added, but vitamin D supplements are also recommended. Parents who are breastfeeding and do not consume meat, fish, and dairy products should provide vitamin B12 supplementation to their newborns. Solids are introduced at 6 months of age. If introduced too soon, food allergies can develop. According to the American Academy of Pediatrics, breastfeeding is the optimal source of nutrition for newborns. Now I'm going to break down the benefits of breastfeeding for just in general, specific to the infant and specific to the mother. So general benefits are for the first few days of life, the baby receives colostrum, which is early milk. It's secreted from the postpartum client's breast during postpartum days 1 through 3. It contains IgA, which provides passive immunity to the infant. Benefits specific to the infant: decreased risk of GI infections, celiac disease, asthma, lower respiratory infections, otitis media, and it also reduces the risk of SIDS, which is sudden infant death. Lastly, benefits specific to the mother: decreased postpartum bleeding and more rapid uterine involution, decreased risk of ovarian and breast cancer, diabetes mellitus type 2, hypertension, hypercholesteremia, cardiovascular disease, and rheumatoid arthritis. Matthew or Aisha?
Okay. The 3 to 6 month nutrition expectations during this period of life, an infant should be able to roll food from the front of his or her mouth to the back. It is important that food is pureed and offered one food item at a time per week to be able to identify any allergies or reactions. Fruit should be introduced first, followed by vegetables. Environmental factors will affect a child's growth and development. It is important to have the right foods and consistency available for the appropriate age child to prevent choking hazards and to meet energy requirements. It is vital to prevent dental caries at this age and to promote hygienic practices that are conducive to eating well. At this age, the parent or guardian should be cleansing the child's mouth after each meal with a clean baby cloth and water. If teeth are erupting, a right-sized amount of toothpaste can be introduced on a baby toothbrush. Matt.
Introduction of solid food should begin around 6 months of age, although it's not uncommon to see introduction of solid food a couple months earlier if the signs of readiness are there. The introduction of solid foods is important as it aids in the establishment and growth and development of fine motor skills. Oftentimes, there is great hesitation from parents adding solid foods to their child's diet due to nervousness or fear of injury. It's important to have well-rounded knowledge on the signs of injury and the signs of readiness for this milestone. Good signs of readiness can be seen by an infant being able to sit upright without support, a loss of infant's tongue thrust reflex, meaning that they do not push food forward out of their mouth when food is being offered. And finally, an infant should be able to pick up things between their finger and thumb. Feeding problems and disorders can present themselves in many different ways, but it's important to understand that the degree to which these problems occur depends on the infant, as they do not always present themselves in the textbook fashion. Common signs and symptoms of infants with feeding problems are as such: arching the back and body while feeding, fussiness or lack of alertness while feeding, chewing problems, coughing or gagging, excessive drooling, difficulty coordinating breathing while eating, and increased nasal stiffness. Depending on the problem, the number of problems occurring at this time, the length at which it occurs can lead to more serious problems or illness for the infant. These more serious problems can present themselves as dehydration, aspiration, chronic lung illnesses such as pneumonia or respiratory infections, frequent spitting or vomiting during or after the meal, and poor weight gain or growth. Rosalia?
Okay. For the child from 12 to 15 months. As the child transitions from breastfeeding to solid foods, it is a good idea to provide food such as baby purees or smoothies. Your child should be given 5 to 6 small meals every 2 to 3 hours, and implementation of a regular eating schedule is also highly recommended. At this point in time, your child is in the social and emotional developmental stage in which they have favorite things and favorite people, so your child may have favorite foods that he or she might prefer over others. It is a good idea to offer a wide variety of nourishing food options such as avocado, banana, oranges, berries, and mangoes to provide the child with a variety of options. Children are responsive to texture and shape changes, so it is also a good idea to be creative with the presentation of food. Fun shapes make certain foods more appealing. Children at this point are also at the point of being able to communicate with simple gestures such as shaking their head. They will be able to indicate yes or no to questions about foods. In this case, the child should not be punished or forced to eat food that they clearly do not like. Instead, there should be different choices available as a replacement. Although they are commonly given, fruit juices are not recommended for children of this age due to the potential for tooth decay. However, it may be given at a maximum of 40 ounces per day. Aside from formula, water should be given to hydrate the child. If the child between 12 to 15 months becomes ill at any point, foods from the Brat diet are acceptable, and the Brat diet includes beans, rice, applesauce, and toast. Lastly, as far as food safety, foods that are small can be choking hazards to children in this age group, so grapes and hot dogs are a few of the foods that should be cut into smaller pieces to prevent choking, and thick foods such as peanut butter should be thinned using water and be given in small amounts to allow for adequate time for the infant to swallow. All right, next is Kenzie.
9 to 12 months, the feeding expectations as the child keeps on growing. At this point, the child is still taking milk at least 4 times a day, and 4 to 5 cereals are still given and continued. Pure foods with strained fruits and vegetables are within process. So the newest to the group is finger food, because at this point, your child is already eating solid foods, so finger foods whereby it helps with the fine motor skills improvement, such as grabbing and the mouth, transferring objects from hand to hand, and picking objects with thumb and fingers helps the child so they can pick up food to eat. With that in mind, the child can grasp the food better at this age, and the foods need to be well, so they are softer or well textured for the child to prevent choking hands. EDC encourages caregivers and parents to give foods with a texture for their child and teaches how to prepare meals so that choking is prevented. For example, grains should be ground finely, boil fruits to soften the texture, cut wholes into small pieces so that you can grasp them. The serve is expected to be about a quarter to a half of a serving of a cup, depending how well your child is consuming food at this point. Also, use can be introduced by non-stress juices due to the acidity levels that they contain, so you can prevent tooth cavities. Jennifer?
The dietary guidelines for the 15 to 18-month-old include 3 to 5 servings of dairy per day, 6 servings of grains, 2 servings of protein and meats, 2 servings of fruit, and 3 servings of vegetables. We are including a pamphlet in our teaching to hand to all the women, which will have examples of these, what you can use for these servings. At this age, it's very vital to teach them and encourage positive eating habits. Erickson defines toddler period as time of autonomy versus shame and doubt. They're becoming increasingly independent, and this is a great time period to start these positive eating habits and work on their fine motor skills by offering and encouraging the use of utensils while eating. When children learn positive eating habits at a young age, they will make healthy food choices as an adult. And we as parents can help teach these positive eating habits by setting a good example, trying to keep a consistent routine serving foods and meals around the same time every day, and schedule at least one meal together as a family. Research shows that having dinner together as a family on a regular basis has a positive effect on the development of children. They thrive when there is consistency in their schedule. At this point, and especially with the current pandemic going on, it is important to remember that mealtime is especially important regarding hand washing and good hygiene. Children this age are still utilizing finger foods and putting their fingers directly into their mouth, which can increase their likelihood of getting sick. Also, keep in mind that it is okay if your child skips a meal or won't eat the vegetables on their plate. Try to remember the big picture. This is very new to them, and if they skip, vegetables one day, if they're appropriately gaining weight when you take them to their checkups, it's okay. Developmentally, I messed up. Sometimes simply arranging the foods on their plate in an appealing manner can entice the children and toddlers to try foods that they otherwise wouldn't have.
Our group did our project on the growth and development on an infant up until 18 months old. Our evidence-based article is a study done on 85 to 87 women followed from 19 weeks gestation until the infant or toddler reaches 18 months of age on a monthly basis in their home. This study was conducted in the Mississippi Delta between 2013 and 2016. It is based on the prevention of obesity, abuse, and developmental delays.